On-the-scene coverage of ACC.13 is supported by Janssen Pharmaceuticals, Incorporated.
Welcome back to opening day of ACC.13. I'm joined again by Chris Cannon, Athena Pappas, and Tony DeMaria. So let's talk about a late-breaking clinical trial. It was the HPS2-THRIVE trial. Who wants to, you want to jump in? Tell us a little bit about what it was, Chris.
Well, certainly. This is a very well done, huge trial, 25,000 patients, to really revisit the benefit of niacin.
Okay.
And this was done using a compound that has an anti-flushing adjunct, Iaropiprant. We all struggle with pronouncing it, but and that has been seen in prior studies to reduce by 40–50% that flushing side effect that would limit the dose that you could use of niacin. So with this, they worked hard. They had a run-in period to try and make sure people could tolerate the agent, then randomized 25,000 patients to niacin with this anti-flushing agent or not.
So a big trial.
Done on the background of current guideline recommended statin and LDL lowering therapy. Okay. So a key aspect to try and say, is this an add-on in well-treated patients with coronary and vascular disease?
What they found, or what happened, or you know?
Well, it was a negative trial, I think, and with a lot of side effects, and I think that's some of the concerns that were expressed. One of the things that we were talking about earlier is that they had a very well-treated group of patients. The beginning LDL was 63 for these patients.
So, yeah.
So you do start to wonder about, given the side effects, which were substantial, if they really had the right target population.
So Tony, if the opening level of LDL was 63, what did it show for HDL and boosting HDL?
Well, it boosted HDL about 14%, 6 points absolute, which is about what you would expect from nicotinic acid niacin, I think. But as Athena says, in the final analysis, that didn't seem to produce much good. And I remember once at a meeting somebody said, this study is not negative, it's resoundingly negative. The number of side effects, diabetes and even infections, offset whatever benefit the increase in HDL might have produced.
So Chris, I mean, so Tony's saying there are some pretty dramatic side effects?
Well, yeah, I think I'll just start with the efficacy. So the hazard ratio was just 4% lower. And interestingly, when they looked at the subgroups, the one that stood out, and niacin lowers LDL, raises HDL, that by the LDL subgroups, there was greater LDL change, not surprisingly, 15 points, the average was 10 in the higher tertile, that they had slightly higher benefit. And so the efficacy, non-significant, trended with its LDL effect. So one could say, well, maybe if you had patients who you couldn't get their LDL down where you wanted it, would this be an add-on therapy? And Christy Ballantyne very nicely pointed that out. On the other hand, the side effects were dramatic and across the board of multiple different areas, many of them known, creating new diabetes, worsening diabetes that existed. Interestingly, bleeding was increased, and infections.
Why those two? Why those two? What's the theory of? I mean, is it?
Jane Armitage pointed out that it's been known that there are antiplatelet effects of niacin, which had been touted as a good thing, although antiplatelets cause bleeding, and so in this huge trial, they saw a significant increase in bleeding. Then there was nausea, GI, diarrhea, skin rash, flushing.
Still some flushing.
Lots of.
So how does this change practice? So Athena, what are you going to do with your patients? Or Tony, same thing to you. What do we do?
I don't know that I'd add it on at this point. I think the question that remains is, in this group of patients, you can't get to goal if this would be, if the side effects may be worth the possible benefit, because we do know there's a benefit of lowering LDL, raising HDL and triglycerides. So
Tony, is this going to change your practice?
Well, it certainly will. I must admit, I'll confess that I did use a fair bit of niacin,
Right.
particularly in people who had low HDLs.
Right.
And I think Athena brings up a good point that this was a population that had an average HDL of 46. I'm not often using niacin in that group, and had an LDL of 69. So what do you do with the patient whose LDL you can't get below 100 with standard therapy, who has an HDL of 25? There may still be a role of niacin there. And I think this action, the European Medicines Consortium is reviewing niacin with some thought perhaps of even taking it off the market. And I think that's too extreme a measure.
Okay.
Yeah. And I would say, the trial addressed, is this an add-on therapy in well-treated patients? There was a lot of use of ezetimibe in patients to get the LDL down. In that setting, this clearly has more risk than benefit.
Okay.
And then it's the lipid clinic type patient where someone who's 30 comes in with an HDL of 18.
Yeah, not.
And our lipid guys, get them on a cocktail and will get the HDL into a normalish range. I think that's still a population where, talking with the lipid experts, they say that, that still feels right to them. But as the routine add-on, I think this can be dropped because there are lots of side effects. Myopathy was increased, and
lots of stuff. Athena, any closing comments?
Well, I just wonder, we know that just adding aspirin before people take their niacin may have the same effect if we could get patients to do that properly to prevent the flushing. So you wonder if we just changed what we did, at least in this high-risk group, that we may be able to use it still.
Well, I think you all made some really valid points. Tony, closing comments?
Well, one comment I would make, this trial enrolled 50% of the patients they screened. That's an astronomical number.
Right.
Typically in these multi-center clinical trials, it's under 10%. So we have to give them credit. This was a really well done clinical trial where they enrolled a lot of the eligible patients.
So a lot of good information came out of this trial, and then some things that may alter our practice. So we want you to come back, stay tuned. We'll have more from ACC 2013.